If you've been trying to get pregnant, you know that ovulation is incredibly important. Understanding if you're ovulating, when, and how to understand that fertile window. So there's been a few common mistakes I've seen along the way that we can talk about so you can sidestep them and feel a lot more confident about your ovulation, about your cycle, about that fertile window, and maximize your chances of pregnancy. Coming out strong is going to be using those period apps to predict ovulation. This is when you enter in a whole bunch of information about your cycle, and it gives you those shaded areas that tell you when your fertile window is and what date you are going to ovulate. The problem is we're not robots. So we don't ovulate necessarily on the same day. Our cycles vary in length every month. And it's using an algorithm to tell you when you should be ovulating, when actually we need to rely more on our signs as we go through it. So I'd rely less on those shaded areas and actually use things like basal body temperature to confirm ovulation, cervical mucus to tell you you're in your fertile window, and even LH on top to tell you getting close to ovulation. You combine those three together and it'll give you a much better picture than what the algorithm is telling you. The second is using LH strips to confirm ovulation. You pee on the stick every month and you think, great, I am ovulating, but actually LH does not confirm it. That's basal body temperature. LH just tells you you have enough luteinizing hormone in your body to possibly ovulate. I like to use it in conjunction with cervical mucus so you get the sense that you're in your fertile window, you should be baby dancing, and you're getting close enough to ovulation. But that alone, if you're solely relying on those strips to tell you that you ovulated, I would take the step back and combine the three biomarkers. And while we're on the topic, number 3, waiting for that LH surge to baby dance. We are missing out on your entire fertile window if you just wait for that surge to happen. So ovulation is one point in time, and so is the LH surge. But your fertile window is much bigger than this. Now, sperm can live in the system for up to 5 days in the right environment. That's your cervical mucus. So when you see the change in CM from dry, sticky to wet, watery, slippery, shiny, right, all these fertile characteristics, now is the time to baby dance. This is where we can make sure the sperm is where it needs to be at the right time. And lastly, we're going to go back into cervical mucus because it's so important. I see a lot of women waiting till they see that egg white cervical mucus, or they're getting really stressed because they don't see EWCM. And the truth is that that's only one characteristic of fertile cervical mucus. So there are others. Don't wait to see it and don't be stressed if you don't see it. As long as you're getting fertile cervical mucus, it's go time. So that could be, it slips when you wipe. You see shiny, stretchy, clear, abundant, wet, watery, right? So all of this stuff is fertile CM, and it's your sign that it's time to baby dance. If you're still uncertain about